Guys, Dave here, Fit and Healthy Forever. This video today is called a medication health rant. Now, Dr. John Bergman, who's a chiropractor and a holistic doctor in America, someone I follow a lot and I get a lot of information from him, emails me stuff. He does seminars one Tuesday in every month, and he gets a class of people in and he does a talk, usually up to an hour. And he did this, he arranged this seminar on medication elimination. And hardly anyone turned up. Now, he always gets full classes, so hardly anyone turned up to this. So he was thinking, why would this be? And he had to think about it, and he decided, well, if you're taking drugs or medication, you think you need them. If you're not taking them, you know you don't need them. So he decided a different approach. He sort of looked at people who came to his practice and had a chat with them, and they're taking medications or drugs, and he come to the conclusion they're having what's called effects. Now, all medications used to be called patent drugs or patent drugs, whichever way you want to say it. This means that they are foreign chemicals in the body and to the planet. If they were natural, they can't patent them because natural medications cannot be patented by law. They can only be patented if they are foreign chemicals that have been made. So if they're natural, they're no good to the pharmaceutical companies because they don't make any profit. They can't patent them. So pharmaceutical companies, we call them within these videos Big Pharma. So Big Pharma can't patent natural remedies, so they can't make any money. All drugs or medications do one of two things. They block a receptor site or poison an enzyme. That is an effect. So that's the sort of effect that people get, one of the effects people get. So for instance, if you look at some of the adverts on the TV, you'll see someone saying, oh, I used to have this symptom or this disease, I took this medication or this drug, and now I feel so good. But what they don't tell you is the potential side effects, because if they're on there, the writing's so small you can't see it, and if they tell you the possible side effects, they say them so fast that you wouldn't take any notice anyway. So this is the same when you're looking at things like insurances as well. You know, if they, you know, it might be for your phone or things like that, and it's such small print you just don't take any notice. So first of all, SSRIs, what are they? They're called selective serotonin reuptake inhibitors, and they're a widely used antidepressant medication, mainly prescribed to treat depression, particularly severe cases, often used in conjunction with talking therapies such as cognitive behavioural therapy or CBT. Now, if you look at these, the doctor will prescribe them. He won't tell you the side effects, but the side effects are on the packaging or the papers inside. Possible side effects of these SSRIs: insomnia, headaches, rash, blurred vision, drowsiness, dry mouth, agitation or nervousness, feeling dizzy, pain in the joints or muscles, upset stomach, nausea, diarrhea, reduced sex drive, problems with erections or ejaculation, suicidal thoughts. I don't think I'd want any of them, to be honest. So studies have shown that when results are compared to a placebo, and I'm sure you'll know what a placebo is, the chances of having suicidal thoughts doubled. So if you're taking these, your chances of suicidal thoughts double. So it's said that sick people need drugs or medication. If a healthy person took drugs or medication, the chances are they would get ill. Okay? So here's the challenge. Health is your natural state. Your body wants to be healthy. It's predominantly born healthy. You just got to keep it that way. So if you start taking some responsibility or some charge for your own health and make some lifestyle changes, like get your blood work done once a year perhaps, it costs £69 off Medichecks once a year, 42 checks they do, give you all the feedback by pathology doctors. I'd do it every year. If you start to drink more water, take supplements, exercise, get more rest and recovery, regular sleep patterns, drink a little less alcohol, maybe stop smoking, just think of it, you could even get healthier. Now, medications build up in the body over time and have massive toxic effects on your body. Now, I'm not saying you shouldn't take medications. What I'm saying is medications usually should be for a short period of time while you're getting your body into some sort of homeostasis where you can come off them and it can look after itself. Your body's designed to heal itself. It can heal itself. You just have to give it the raw materials, which I've said before in videos. Your body can, if you cut yourself, you don't need a pill or a drug or something to heal it. It'll go all red, it'll start to heal up. The inflammation is the start of the healing process, and then your body will heal itself from inside. And it can do that's a simplistic way of putting it, but your body can heal itself. You just have to help it along. Do the right things with your body. Eat the right things. Don't binge drink. Don't smoke. Don't take drugs. Exercise. Get your proper sleep, rest and recovery. It all goes towards it. So, as I say, they build up over time and have a toxic effect, a massive toxic effect in the body. Now, I've seen people I've worked with, and they sit there I'm not exaggerating, every day, and they've got ibuprofen, paracetamol, cans of Red Bull. It's just to get them through the day. Your life shouldn't be like that. It just shouldn't. You shouldn't need things like that to get you through the day. If you've got headaches that bad that you've got to keep taking ibuprofen every day, there's something else seriously wrong. You don't need to keep taking those. You can take them in the meantime while you get your body right, but you shouldn't be taking them indefinitely. They're toxic to your body. So I thought to myself, what's the common advert on the TV these days? First one sprung to mind, Voltarol. The guy's running around chasing a rabbit. His wife says, oh, yesterday he couldn't even walk or sit down, blah, blah, blah. So she rubbed Voltarol on him and he's running around like he's 18. So, side effects of Voltarol: skin irritation, itching or redness, inflammation of the skin or dermatitis, abnormal reactions of the skin to light, usually a rash, photosensitivity, allergic reactions such as narrowing of the airway, which can cause difficulty breathing, swelling of the lips, throat, tongue, or severe skin reactions. Now, again, if you've got backache, back pain, whatever it is, go and see a chiropractor, see if they can put it right for you. Instead of keep buying this stuff all the time and putting it on your skin. It's not good for you. Yeah, if it's a one-off and you've tweaked something, it might work in the short term. But if it's a long-term thing and you keep getting it, there's something wrong. There's something wrong with your alignment or your muscles or whatever. You need to go and get someone to have a look at it. And if you can afford to, pay private to do it. Sometimes your chiropractors are not that expensive. I've had them on Groupon and got my first consultation free. So you can do things like that. But going to your doctor, all your doctor do is prescribe you a drug, painkiller or something like that. It's just crazy because that's all they know. Drugs, medication, surgery, that's all doctors know. Allopathic doctors, which is your general GP, doesn't know any different, most of them. They don't know holistic remedies and things like that. So the next one I thought of, I looked in our cupboard and we've got some Germolene antiseptic cream. Side effects: frequency not known, allergic skin reactions such as dermatitis, pruritus, erythema, which I don't know what they are, eczema, rash, urticaria, don't know what that is, skin irritations, blisters, also hypersensitivity including anaphylactic shock. Now, anaphylactic shock can kill you. Anaphylactic shock is an extreme, often life-threatening allergic reaction to an antigen to which the body has become hypersensitive. An antigen is a toxin or other foreign substance which induces an immune response in the body, especially the production of antibodies. So, again, I don't know if you're aware, I was aware, but I didn't realise the severity of it. All medications have side effects. Not everybody gets them all, not everybody gets any of them. But personally, I wouldn't want to take the chance, because I think the older you get, it's especially if you're not doing all the right things, your body can't always fight these things off. You've got to try and keep your body in tip-top condition as best you can to have any chance of fighting these things off. As I said, I'm not knocking these things. What I'm saying is, in the short term, as a one-off use, they're fine. You can use them, and one-off thing, you're unlikely to get all the side effects or any of them. But I have seen people, and people who've worked with me will know, maybe even know the people I'm talking about. They've constantly got painkillers and tablets and pills and all sorts of potions and lotions on the desks at work, and they're constantly taking this stuff. It can't be right. It just can't be right. So this is out of an ibuprofen packet, and this is the side effects. Allergic reaction, and it lists 4 different ones, from asthma, swelling of the face, rapid heart rate, stomach and bowel problems, and it lists 7 of them, including passing blood in your stool, indigestion, heartburn, pains in your stomach, vomit any blood and dark particles that look like coffee grounds. Blood disorders, it lists 4 of them: fever, sore throat, extreme paleness. Heart and circulation effects, medicines such as ibuprofen may be associated with small increase in the risk of heart attack. I don't care how small that is, I wouldn't want it. Again, if you take them for a one-off headache, I've taken them for muscle soreness when I've trained 48 hours later. Not all the time, but when I felt it's needed, I've used them. But not constantly. You shouldn't be constantly taking these things. If it gives you any of these things. And then it's got other side effects that may occur, include other stomach and intestine effects, liver problems, kidney problems, nervous system problems. And then it tells you how to report side effects so they can gather data and make it safer later on. Great. So in the meantime, you've got to suffer it. I know a lot of you out there will probably think, well, I know the side effects to all these things. What I'm trying to say is, I've seen this firsthand when I was working. You should not be taking these all the time. To me, they're there to be used as and when, if and when you need them. Not all the time. And I've seen this all the time. And as I say, if anyone I worked with listens to this, they probably know the people I'm talking about. So please be aware of this. These holistic doctors know what they're talking about. What they say makes sense. It's logical. It stands to reason. You don't need a pill or a drug or a medication for every little thing you have. Let your body heal itself. Do the right things. You'll thank yourself in the long run, I promise. Anyway, rant over. Thanks again. I do appreciate the people who listen and try and take things on board. Whether you agree with me or not, I do thank you for listening and taking the time. And I hope a few more people will take the time to try and make some changes in your life and try and live healthier and fitter lives. It's just, I've said before, I can't explain how good it is. You've got to know it for yourself. So please have a go at it. Until the next time, stay fit and healthy forever. Like, subscribe, tell all your friends. If you think this may apply to someone, have a word with them. You don't need to be using these all the time. Thanks again for listening. Until the next video, bye.